Veneers, what are they, what aren't they? Veneers have become a very important part of all the treatment that we do every day, to be able to help patients with their smiles and with their oral health. I think generally what I find is that veneers are associated with obviously cosmetics. It is interpreted to be this little layer, the small layer that comes on the front surface of the tooth, like for instance like a fake nail, and it is there to purely enhance the smile's features and enhance the color or change the color, which is not entirely correct. Yes, of course, it's a wonderful tool for us to be able to change smiles and to make smiles look better, of course, for the patient, which is also very important. It helps with confidence and everything else. But I think the word veneer really means thin, so ultimately it is that shift again that we did from conventional dentistry. So in other words, crowns that we used to utilize, cutting a tooth into a little tiny stump, putting so much trauma on the tooth to be able to attempt to make it better. Veneers are modern dentistry, so we were able to get these materials which I now can apply much thinner. So I have a tool now, I have a protective layer which I can put onto the tooth without destroying it or creating more damage. And so in other words, veneers are there to protect the teeth. Veneers are made to preserve what I've got from wear and tear, from damage. It is also there to restore what I've already lost. So in other words, if I've worn my teeth down and I've broken it, I have multiple fillings, I have multiple root canals, whatever the case may be, I'm able to put a layer on the tooth without creating more damage. And I think that's the essence, that's the key of veneers. So in other words, I will often or end up with a case where a specific patient will have a 360-degree veneer, or resembling something like an old crown. So where the full tooth needs a cover, because the damage is not just on the bite levels, not just on the front, but also on the back part of the tooth. So in other words, if we want to open up a bite, if we want to restore function on these teeth, we obviously need the full cover. So the concept is to do as little as possible, and I think that's where the veneer or the concept comes from. It's not to destroy it anymore, it's actually to preserve the teeth. And of course these things obviously give us a wonderful aesthetic result. Cosmetics have become the bonus of veneers, and I think therefore the association with cosmetics. It's wonderful what we can do these days. They can look so natural, or they can not look natural for that matter, for the patient that doesn't want it to look too natural. But the point is the sky is really the limit for what we can achieve with these things from a cosmetic perspective. But ultimately it is there to preserve and to replace the damaged parts of the teeth of a patient that have already had some damage. On the other hand, we have a lot of patients that have zero damage yet, and they will have to have other treatments like orthodontics or cosmetic bonding or whatever the case may be. But veneers and ceramic veneers are there to actually protect the teeth and to make it stronger so that it can last longer into the future. And so the veneer is not just a little layer that sits on the outside of the tooth necessarily. Sometimes we have to put it in all different categories or parts of the tooth to actually make it better, but it is a wonderful tool and we utilize it basically every day in our practice.